I've done every bit of my training here at UMC, from medical school to residency to a chief resident year, then on to fellowship. What has kept me here every step of the way is the camaraderie that I share with the people that I work with, as well as serving the patients of Mississippi.
The University Medical Center is the only academic center in the state, and so it's a massive safety net hospital, extremely academic environment. You'll see that when you come here, it feels intimate and familiar, and it's warm and welcoming despite being a large academic center.
The emphasis of our program is on excellent clinical care. Some of the clinical services that we provide would not otherwise be available.
Our division is active in clinical trials, in research, very active in education at not only the medical student level, but the residency level and the fellowship level.
You can imagine we see a wide variety of pathology, which provides excellent training opportunities and educational opportunities for our fellows, including advanced bronchoscopic and pleural procedures, right heart caths, and they even get some training on ECMO. One of the big benefits is that we have several faculty members that are subspecialty trained in these areas, and so our fellows really get to benefit from their expertise.
We have an appropriately very busy ICU, and I think that's good. That's perfect for training. And what's unique about Pulm Critical Care Combined Fellowship is that you have the slower-paced pulmonology aspect of it, where you're spending a lot of cerebral time in the outpatient setting. And then you have our interventional team, which I think is so valuable and not slow-paced at all. So the 3 years go by quickly, but you're getting everything you're supposed to get and more.
Our fellows played an integral role in the institution's code response at the bedside. That occurred because our fellow training is very clinically oriented. They are able to take care of very sick patients, recognize very sick patients, stabilize very sick patients. Our fellows have also started a post-ICU recovery clinic to help with the continuum of care in ICU patients once they are discharged. The fellows' role, not only in our division but our institution, is paramount.
The 3 years of training here will make you comfortable with managing the most complex patients. We don't have a separate IP fellowship here, so that's kind of a blessing in disguise that you are the first person on those cases working directly with an IP attending. We also get like a lot of fluoroscopies, pleural biopsies, pleurix catheter placements.
From a pulmonology standpoint, you get a lot of experience doing bronchoscopies, both oral and nasal airways. There's also cryoablations, IP procedures with rigid bronchoscopies, thoracotomies, that kind of thing. So there's really a wide array of procedures that you want, including tracheostomies.
And because we have such a large underserved population, we see a lot of diseases fairly advanced. From a training standpoint, it leaves us well equipped to take care of any patient population base.
Point of care ultrasound is a concept here that we rely on a lot. We can do really quick ultrasounds of the heart. We can evaluate kidneys, we can evaluate lungs, we can evaluate vasculature all throughout the body. And it gives you a really good idea of what's going on at that point of time.
Our fellows get a broad range of experience in both our medical ICU, but in the surgical ICU and the neurosciences ICU and our cardiovascular ICU. So several areas of emphasis for us in recent years have been developing our program in interventional pulmonology. We've developed a program in pulmonary hypertension, and we have our center in adult cystic fibrosis.
We have a new state-of-the-art sim lab that's just a couple years old. And so as new fellows, we had the opportunity to go over there and do a boot camp where we train practicing all of our procedures.
We practice putting all kinds of lines, thoracentesis, chest tubes, airway management, difficult airways.
Any job after that, it's gonna be pretty easy and comfortable for you.
The good part about Jackson is that it is the state capital, right? So it's kind of considered like the metropolitan area of the state, but then it's also kind of a smaller city, so everything is very accessible. My husband and I really enjoy the restaurant scene around here.
The restaurants around Jackson are probably some of the best.
I have 2 kids, and so taking kids and the family to parks, there's some great parks, and going up to the res and sitting by the water is really nice. There's things for everybody.
The best things about the University of Mississippi Medical Center, as well as this fellowship program, is all of that Southern hospitality that all trickles into our program.
One of the big draws to the area and to the program for me as well, outside of the academic aspect of it, is the hospitality is amazing. Everyone's incredibly nice. Everyone's having meals at their house and inviting everyone that you can think of over.
When I came down here during interview day, I saw how much people were laughing during conference and just seemed like a very friendly environment.
Our faculty is always available. I think they do a really great job of balancing the autonomy with giving you appropriate oversight and backup whenever you need.
The staff and other fellows here are incredibly receptive. I feel like if I needed help with anything that was happening in the hospital at any point, I could approach any one of them and they would do everything they could to drop what they were doing and help.
We are all like good friends. My upper levels have been super helpful. They are always available if you need them. They walk you through the procedures.
So from fellow to fellow, resident to resident, fellow to attending, there's this camaraderie. You text them anytime. Everyone's on a first name basis. There's no hierarchy. It helps so much with your development as a doctor as well as your training.
I've gone out of my comfort zone and I've learned so much more by doing that. But even though I'm out of my comfort zone, I still have so much support and I have help when I need it. I can send out an SOS and I know someone will be there. That provides just a very comfortable learning environment. It will be the best decision that they ever make, and you shouldn't second guess yourself on it.
Our pulmonary critical care program is a great place to train, and our fellows are well prepared to pursue any career path that they may choose. We're excited for you to come check it out, and we are sure that you'll feel the same way.